This is Counterstrain for AC1, the transverse process. So the location is just behind the earlobe, and so you're gonna push and see if either one of those are tender. If she said that this left side was tender, we would treat that one. So I'm going to tell her that this is a 10 out of 10, and I'm going to put her into treatment position, which is rotate away. So I'm gonna rotate her away. And then I'm gonna ask what her pain is now.
A 2.
It is a 2. So if it's anything less than a 3, you can just keep it in this position. You're gonna hold it for 90 seconds. And then after the 90 seconds has passed, you're gonna passively put her back into position. And then ask what her pain is again.
1.
1. Okay. This is Counterstrain for AC1 mandible. The location of this point is midway between the ramus of the mandible and the massoid process. So I'm gonna find the massoid process, the ramus, and go halfway between. The treatment position for this is to rotate away. So if I'm treating her left side, I'm just going to rotate her this way and then follow the normal counterstrain technique. This is the treatment position for anterior cervical 2 through 6. The treatment position is going to be flexed, side bend away, and rotate away. So if I'm treating her left side over here, I'm going to flex her, side bend her away, and rotate her away. Follow the normal counterstrain technique, and then passively return her to neutral. This is treatment position for anterior cervical 7. This is also the clavicular attachment of the SEM. The treatment position for this is going to be flexed, side bend towards, and rotated away. So if I'm treating her right side, I'm going to flex her up, side bend towards the right, and then rotate her towards the left. Hold that for 90 seconds, and then return to neutral. This is the treatment position for anterior cervical 8, which is also the sternal attachment for the SEM. The treatment position for this is flex, side bend away, and rotate away. So if I'm treating her right side, I'm going to flex her up, I'm going to side bend her towards the left, and rotate her towards the left. Follow the normal counterstrain technique for that, and then passively return her to neutral. This is Counterstrain treatment position for PC inion, and it is on the inferior nuchal line lateral to the inion. The treatment position for this is flex, side bend towards, rotate away. So if I am treating her right side, I'm going to flex her up, I'm going to side bend her towards the right side, and I'm going to rotate her left. Follow the normal counterstrain technique for that, and then return her to neutral. This is Counterstrain treatment position for PC1 occiput. The position for this is on the inferior nuchal line midway between the inion and the mastoid. And the treatment position for this is going to be extend, side bend away, and rotate away. So if I'm treating her right side, I'm going to extend, I'm going to side bend towards the left, and rotate towards the left. Follow the normal counterstrain technique for that, and then return to neutral. This is the Counterstrain treatment position for PC3 midline spinous process. The treatment position for this is going to be flexed, side bend away, rotate away. So if I'm treating her right side, I'm going to flex her up, I'm going to side bend her left, and rotate her left. Follow the normal counterstrain technique for that, and then return to neutral. This is Counterstrain treatment position for PC4 through PC8 midline spinous process, as well as PC3 through PC7 lateral. And so, as you can see, I have the patient off the table because the treatment position is extend, side bend away, rotate away. So to get the proper extension, you can have them off the table. So if I'm treating her right side, I'm going to extend her, I'm going to side bend her towards the left, and rotate her towards the left, following the proper counterstrain technique, and then return to neutral.